Yeah, well, I am very excited to be here and be talking with both of you. My background is has been in orthopedics and biologics for the last 15 years. So I started out at a company called Arthrex, and Arthrex was really is the PRP leader in the world. They run about 35% of the world market, and I launched several of those products to the sales force when we were there, as well as other skin graft, amnion products, and bone grafting, things like that. And in my time there, we ran across a lot of wound care opportunities, but we were an orthopedic company. Fast forward to 2021, this company, Nuo Therapeutics, reached out to us because we had a previous relationship with them. In 2012, they transferred ownership of the Angel system over to Arthrex. So we knew who these guys were. We knew how great their technology had been. And so they reached out to us and said, hey, we received a national coverage determination on the Oryx system. And fast forward to 2022, we came over to re-commercialize the system with them. So that's how I ended up here. And that's a little bit about who I am and kind of the background in PRP that I have.
Awesome. Thank you. So Kallie and I talked about how SAWC Spring was really when we first met you and another company where kind of like PRP started off with two companies and then spring fall now there's four. With all of the CPT changes, where do you see PRP going? Is it the next big thing? Is it where we're all going to head to in wound care?
Well, I think it is going to be a big thing. I don't know if it's going to be the big thing. And the reason I say that is I don't think there ever should be one therapy that's the big thing. I think the skin sub things that happened over the last few years probably shouldn't have happened. But I think there's a place for wound vacs, for HBO, for debridement, for good, good wound care treatments, no matter what the modality. Now, I think PRP has a unique place in that the healing rates are really, really high with PRP, especially on tough to heal patients. So I do think we're going to see a larger portion of the market move to this, much larger than current, certainly. And we know of several companies looking to get into the space. So I think you're going to have some firepower behind the PRP world with some bigger name companies. We're going to be one of those big name companies. But I do think that it will become a standard of care in every wound care center. So I think you're going to see it, the conversations we have now are, oh, we don't draw blood, right? And we had those same conversations 10 years ago in sports medicine. And fast forward to now, every sports medicine group has a PRP person because the data has caught up as it has in wound care. And there was a revenue stream and the patients did really well. And that's what's happening right now in wound care. So I think, the data's there, the reimbursement has caught up, and the patients do extremely well. So I do think it fits well into the algorithm of a wound care center. And I do think it will be a standard of care. And I think it'll be a lot bigger than it is now. But we'll see if it's the big thing. We'll see. I hope.
Yeah, no, I love what you said. And, we're such big proponents of that too. There should never be one thing that we're all relying on. Wounds are so different. Our patients are so different. And it should just be another thing in our toolbox to choose from to be able to give our patients the best ability to heal. So I love that you said that. Let's talk more about Oryx. So can you kind of compare your product to the others that are on the market? What makes you a little bit different? How's your product stored? How long does it take? All of those things.
Yeah, well, that's a loaded question, right? I'm going to tell you all the things that I love about Oryx. So I'll start with the other companies out there have really cool products, and they're cool in different ways. We think we have the best mousetrap, and I'll walk you through why. So the first thing that I think is key is we are an American company, 100% American made, and we helped to develop this code with CMS. So we have an intimate understanding of this code and how it works, and we were involved in overturning the non-coverage decision. So from just an investment standpoint, our company is the company that made the investment in getting the reimbursement done. So that's something I think is important to remember with this whole process. But yeah, I'll give you the quick hit points on the Oryx product. So one of the great benefits of this product is you only need about 3 to 5 cc's of blood to treat a pretty large DFU. If you want to collect all the blood you want in the kit, which is up to 30 cc's, we can treat a 2,000 square centimeter wound. So I'm unsized and I have unlimited sizing because you can expand my kit with more tubes. So on those really large wounds, financially at a wound care center, those are hard to treat. But with the Auric system, you can treat them. And because you have 20 weeks of therapy, because you usually see about a 50% reduction in 2 weeks with the Auric's product, those big wounds get small quick. So that's one of the benefits is we don't need a lot of blood. The second is we can cover a large wound. The third is our centrifuge is very small. It's 4 pounds, 7 inches across, takes up minimal space. And it's a 52-second spin. It's super fast. So our whole process, usually by the second or third time your staff does it, we're about 6 minutes on average. The only variable piece of that is the blood draw. The centrifuge is something I think is worth bringing up. PRP is an important piece of this. There are some other blood therapies on the market, like, for example, Red Dress Actigraph and Reaplex 3C. Those are blood patches and clots. But PRP is concentrated growth factors. What the centrifuge does is refine those growth factors and concentrate them. And then we add in our pharmaceuticals. So the spend time, the prep time is fast. The blood draw is small. The coverage is large. And the key component to this system that is more key, and that's the reason we have our awesome data, is the vitamin C. So our kit comes with some pharmaceutical reagents that really increase our healing time. So when we did all this data collection back with Curative Therapeutics back in the late 90s, they had 3 studies they did with the FDA on platelet concentration and which ones heal wounds best. And that's where Aurics came from. But in that whole process and through other publications, we realized these wounds are all deficient in vitamin C, all of them. And they're almost in some stage of scurvy because there's poor perfusion down to the wound. There's chronic inflammation. They're on a multitude of drugs, blood thinners and things like that. And no matter what the patient does to try to change that, the perfusion does not get the vitamin C there. So when we include that in our product, we get rapid collagen formation. Vitamin C is there to cross-link those collagen fibers into that super tight triple helix of type 1 native collagen. When vitamin C is not there, you have a loose winding, those wounds reopen, or you get scar tissue. So the vitamin C is one of the components that this system really makes this system special. And we're one of the only companies that can put that in the system per the FDA regulations. Why we think we are, one of the better setups of a system and why our system has the amazing 81% 12-week healing rate that we had in our RCT. And we did, on our level 1 study, we overturned a non-coverage decision with CMS with our study. And Medicare wanted to see how we could treat a real Medicare population. And so we had an all-comer study. We had Wagner grade 3 and 4 wounds. Almost all the wounds were Wagner grade 3 and 4. We had to include comorbidities. So we had to include smokers, peripheral artery disease, obesity, the things that get cut out of all these other studies. And we had to test it against whatever these centers used, including advanced therapies. They all used HBO, skin subs, or wound vacs. And at the end of that study, our healing rate was 37% higher than the standard of care in those centers. So very compelling, which is why that national coverage decision was awarded.
Yeah. There was something that you kept mentioning that I was going to ask next is we've obviously been using PRP in a few of our centers as it's come out. And one biggest challenge that our clinicians gave is the blood draw. Most of us haven't had to do that in a long, long time. Some of us, if we've done only wound care, haven't had to do it. And our patients are older. They're a hard stick. So what kind of is that the challenges you're seeing in other centers? How have they bypassed that? What would be some of your suggestions if this is kind of a hurdle that a clinic, it's the reason why they don't want to try PRP?
Yeah, that's a great question. And that's something that initially 3 years ago, we got from a lot of hospitals is we don't want to do blood draws. We don't know how to do blood draws. What we're finding, and again, this tracks almost identically to what we saw in sports medicine 10 years ago. Nobody had MAs that could draw blood. None of the sports guys had drawn blood since medical school. And what we're finding now is that there's certainly a willingness to try. So we're getting over the hurdle of we don't want to do it. The reimbursement changes certainly are helping people say, okay, definitely want to try, given that there's some reimbursement there. But once they do it on a patient and they see the healing, that's where this idea of, I don't know if we want to do it, then it's, okay, we want to do it. Now let's see if we can get blood out of this patient, right? And so we've overcome that hurdle in most of our centers. And there's some best practices that we are implementing to get to make the blood draw easier. But you are right. These patients are really sick a lot of the time. They're really hard to get blood out of sometimes. I'd say on average, 5 to 7%, we can't get blood out of. And that's why I think, again, we fit in a great algorithm of wound care. You bail and go to another product, a skin sub or something else. So, but typically the best practice is have the patient hydrate a lot before they come. And we had the same problem, and even in sports medicine, even young teenagers would come in super dehydrated. You couldn't get blood out of them and come back a week later, drink, 40 to 60 ounces of water before you come in. And they got these big juicy veins then, right? So hydrating is key. And I think that is always a challenge with some of these patients and their nutrition is just be hydrated. We have improved some of the needles in our kit. We found that there were some problems with the needles. Some of the people didn't like the needles. So we've put some a much easier flashing needle in our kit. I think that every company is going to have some of these problems. And then we're exploring other options. We are partnered with a national phlebotomy group. So if a center can't do it or doesn't want to do it, we can have an outside group come in and do it. The other thing we've explored is things like vein finders and all that. But generally, we don't have that issue on most of the patients. And especially, it's funny, a lot of these patients who've dealt with these stalled wounds for a long time, they're a little nervous and apprehensive about that first blood draw, even though they get stuck all the time in the hospitals. And then when they come back and that wound is, 25, 30% healed, they go, hey, stick me again. Let's go. Let's heal this thing, and within 6 treatments, they're usually healed most of the times. So again, yeah, we understand that it's a change in paradigm in the wound care world to start drawing blood. But I do think it's not really a matter of if, it's more a matter of when you're going to start doing it, because there are other companies getting in. Now that the code is fully reimbursed across all points of service, and now that the skin subs are potentially going to go under some changes, it's a great option for centers, from a revenue standpoint.
It actually kind of leads right into what I was going to ask, Dave. You talked about what can help with the blood draw is making sure clients are hydrated, things like that. What are you seeing with patient compliance? How often are they need to come in to, receive this treatment? And just anything that, could help with that patient education factor.
Yeah. Well, I'll start with the patient education factor because I think that's really important, right? I mean, wound care oftentimes is a challenge of compliance, and we all know that, and we've dealt with that for years. But we have a really nice, clean patient explainer video that's an animated video that talks in layman's terms about what we're doing and about what we see with these with our data and these wounds that are healing. We find that a lot of patients, once they watch that, they say, okay, I want to do this. I want to try this. So that's really helpful. And then we have some standard operating procedures, and we have some pre-treatment protocols we like to give to patients to talk about hydration. Hey, don't drink, only coffee the morning of your blood draw. Go drink some water. But as far as compliance goes, we do rely on the patient to be somewhat compliant, right? They have to drink water. They have to be willing to get their blood drawn. But the cool thing about this product is the rest of the compliance is lower than some other products, right? Because once this goes into the wound, we put either a Mepitel or a Tegaderm that's fenestrated over the top, and they can go about their day. They can have pressure on it. They can walk on it. They can do whatever. And this is still going to work really well. Unlike other products where you have a graft or a clot or something else that you don't want moving around. This product, once it flows down into those areas, it's going to activate those receptors and it's going to start its healing process. So,
yeah, thank you. And actually, you literally led right into the next question. Primary dressings, secondary dressings, best practices, recommendations, right? Because it's kind of like right now, trial and error for what works for each patient, right? Every patient's different, every wound's different. But just from your perception, like what is the best practices for that?
It is 100% a trial and error scenario. So when we first launched this, we were recommending doing a Tegaderm that's been heavily fenestrated. And that works great. What's funny is in the wound care world, the Tegaderm is less popular than in the sports med world where everybody uses it. So we realized that, okay, maybe we got to talk about something else. But what we found is something like a Mepitel works really well. Something that has fenestrations in it that can breathe, right? So these are wetting products. It's going to wet the wound a little bit, and we don't want maceration. So anything that can breathe is what we're looking for. We want to avoid things that are petroleum based because like an Adaptic that has Vaseline on it. If you have the Adaptic that doesn't have Vaseline, great, go ahead and use that. But if it has petroleum, that's going to be somewhat cytotoxic to the cells. We want to keep that out. But as long as it can breathe, so our kit comes with a contact layer veil dressing. You cut that down to size, put it down in the wound, holds the PRP in place. Then you throw your Mepitel or your fenestrated Tegaderm or whatever, your breathable primary layer dressing, then just some absorbent dressing over that. And our product is usually viable for 2 to 3 days. I recommend leaving it on for 3. You can leave it on for the full 7 days between treatments, anywhere from 5 to 10 days. And once a week is kind of what we recommend. And it works great if you leave it on. But if you have somebody with a heavily exudating wound and you're worried about maceration, then home health or the patient can remove all of those dressings after 3 days and just do an absorbent dressing after that. And you're going to have the same result with the product. No, I mean, we're just super excited. We love the Wound Care Advantage relationship. You guys have been fantastic, really, as far as introducing new technologies to your accounts and holding the account's hand to learn the new technology and go through the reimbursement and know that the reimbursement is going to be there. Because what you find is some of these other management companies, they just throw a bunch of stuff in and you got to figure it out on your own. So we've really enjoyed working with y'all, and you really have been an advocate for your customers with us. We've had to develop some things to help your customers. So we like this relationship a lot. We're really happy with what you guys are doing. And we do think this will be one of the standards of care pretty soon.
Yeah.
Yeah, so do we.
Thank you, Dave, for always willing to participate in any crazy idea that we
have.
Well, I enjoy it. I really do.
Listen or watch full episodes on YouTube or Spotify.